The nurse is caring for a client who just had an arteriovenous shunt inserted for hemodialysis. What should the nurse do? Options: cover the cannula with an elastic bandage, notify the physician if a bruit is heard in the cannula, use surgical aseptic technique when giving shunt care, take BP on the arm with the shunt every 4 hours. Answer: use surgical aseptic technique when giving shunt care. Arteriovenous shunt കെയർ ചെയ്യുമ്പോഴത്തേക്ക് അല്ലെങ്കിൽ ഇൻസേർട്ടഡ് ഫോർ ഹീമോഡയാലിസിസ്. സോ വി ഹാവ് ടു ടേക്ക് aseptic techniques while caring the shunt, otherwise it results in infection. So answer: use surgical aseptic technique when giving shunt care. The nurse is reviewing the physical examination and lab test of a client with malaria. For which important clinical indicator should the nurse be alert when reviewing data about the client? Polyuria, leukocytosis, splenomegaly, and erythrocytosis. Answer: splenomegaly. In hyperactive malarial disease, splenomegaly occurs, and this is mainly because when the parasitized RBCs are entrapped in the spleen, and the spleen becomes enlarged due to filtering out of excessive destroyed RBC after hemolysis. So here the answer is splenomegaly. A client is concerned about malaria while visiting relatives in Southeast Asia. Prevent her from malaria, what should the nurse teach the client to avoid? Options: mosquito bite, untreated water, undercooked food, overpopulated area. We know that malaria is transmitted through mosquitoes, so we have to instruct the client to avoid mosquito bite. Answer: mosquito bite. When assessing a client during peritoneal dialysis, the nurse observed that drainage of the dialysate from the peritoneal cavity has ceased before the required volume has returned. What should the nurse instruct to do? Options: drink 8 ounces of water, turn from side to side, deep breathe and cough, rotate the catheter. Then answer is turn from side to side. And here the turning or moving helps in or facilitate the flow of dialysate solution. So we instruct the patient to turn from side to side. A client is diagnosed with gastroenteritis. The nurse understands that the basic intention underlying the dietary management for this client is to: options: provide optimal amount of important nutrients. Second option: increase the amount of bulk and roughage in diet. Third: eliminate chemical, mechanical and thermal irritations to the stomach. Then provide psychological support by offering a wide variety of food. So here the answer is eliminate chemical, mechanical and thermal irritations, because the patient is having gastroenteritis. So we have to avoid irritation to gastric mucosa, otherwise it again increases the condition and causes diarrhea to the patient. So we have to avoid gastric irritants to the patient. So here the answer is eliminate chemical, mechanical and thermal irritations.